Let's do a review of the male now and discuss all the features of the male that you need to know about. To orient yourself, the inferior portion or the legs would be found down this end, and the head, if you continued upwards, would be up that way. Okay? This here is our urinary bladder. As you can see, it's kind of pyramidal in shape. Okay? When distended and full of urine, it will become full and become oval-like. All right? Posterior to it, you have your rectum. The rectum is what starts at about S3, comes down and becomes the anal canal. Okay? So what are some features that you need to know about in the male? First, let's talk about the bladder, male urinary bladder. The bladder consists of several surfaces. You have your apex, your superior surface, your two inferolateral surfaces, one of which is cut away here, and then you have the base, or the posterior surface. The neck of the bladder is what will sit right on top of right here, which is the prostate gland, right here. Prostate gland. The apex of the bladder rests on the back of the symphysis pubis, and the back of the pubic bones. We have our superior surface, which comes in contact with the peritoneum. Then on the posterior surfaces, we have two major structures, the seminal vesicle and the ampulla vas. And the ducts of these two vessels or secretory, either pathway or gland, will form to get the ejaculatory duct, which empties into the back of the prostate to go into the prostatic urethra. I'll tell you more about those in just a second. So if we have urine that comes down from the kidney through the ureter, right? The ureter is going to be coming down. You can't, it's just out of view here, but this guy here is the common iliac, right? And the common iliac will split into the external iliac and the internal iliac artery. And the ureter will pass right over top of the bifurcation of the common iliac. Okay? So as it comes down, it goes into the bladder at the superolateral angle and is crossed over by the vas deferens, which again I'm going to tell you about more in a second. As urine is brought into the urinary bladder, it is here where urine is stored until urine will go towards the neck of the bladder through the prostatic urethra, which is found right here. At this level here, where we're going to find the space between the two ischiopubic rami, this here is the UGD. Attaching to the UGD is the root of the penis, which is divided into the crura and the bulb. But to give you an idea of where urine is, so if we keep this going, we have urine coming out of the bladder through the prostatic urethra, through the membranous urethra, and into the spongy or the penile urethra, which it continues to go to until it goes out of the penis. Let's stay focused on the penis itself here just for a second. So if we have as I said, the prostate gland, which rests on the superior surface of the UGD, and on the inferior fascia of the UGD, we have the root of the penis that attaches here. And the root of the penis is made up of the crura of the penis and the bulb of the penis. The crura of the penis is continuous with the corpus cavernosum tissue, of which they are paired. And you have a left and right crura. So the left crura is continuous with the left corpus cavernosum and the right crura with the right corpus cavernosum. And the bulb of the penis is continuous with the corpus spongiosum, which is this tissue. Okay? So you have crura, bulb, and then cavernosum, spongiosum. Okay? Going back towards the relationships that make up the posterior part of the bladder. What we have here are the testes. Testes will eventually synthesize and from stem cells the spermatogonia through a process called spermatogenesis. The sperm will go through the epididymis, which is this one single long coiled tube that goes along the convexity of the testis, and it exits the testis as this single cord. If I can show it to you, here we go. This single cord here, which is the vas deferens. The vas deferens continues up, goes through the inguinal canal with the gonadal vessels and some lymphatics, goes up over the ureter, and then comes to the posterior part of the bladder, the most medial of the two structures there, and then ends up forming a duct with the duct of the seminal vesicle, which is called the ejaculatory duct, and empties into the back of the prostate. Okay? The other item that is on the posterior aspect of the male urinary bladder are the seminal vesicles. And they create the lateral relationship there on the posterior surface of the urinary bladder, lateral to the ampulla of the vas. Okay? So ampulla, vas, seminal vesicle. And those are both paired. Lastly, what I want to show you here is if I move this a little bit, and again, to give you your bearing, we still have our urinary bladder here, our rectum, as our rectum comes down into the anal canal here. And on either side of the anal canal, you're going to have these bundles of connective tissue for which the pelvic diaphragm inserts into. And if you remember, those two are called the perineal body and the anococcygeal body. Okay? And so, remember, levator ani will originate from the back of the pubic bone, go across the white line, and also originate from the ischial spine and insert into the anococcygeal body and the perineal body.